This is a demonstration of the cervical syndrome setups in the Thompson terminal point technique. If my patient has a short leg and she turns her head to the left and the legs balance, I will palpate her neck with the head straight down, and on the right find the tender nodule. I will then set up on it, roll in on it with the radial aspect of my index finger. I'll ask her to turn her head to the left, the side that balanced the legs. I'll then stabilize around the ear. Thumb goes behind, fingers in front. I'll get my elbow in towards my body and I will adjust. If my patient had multiple tender nodules on her right, I would do a right first rib adjustment, aka left overcompensated cervical syndrome. I stand straight away from the first rib. I'll take an index finger contact over the first rib and actually bend my fingers towards my body. Her trap muscle goes in my thumb web. So my thumb is as close to her neck as I can get it, and my index finger is on top of her first rib. She will lift her head straight up off the table, and I will bring the head over to me. My line of drive is S to I, with an I to S lift in the skull. If my patient had a bilateral cervical syndrome, she would tuck her chin. I would tilt the headpiece down all the way. I would take a bilateral thenar contact on the back of the head. My line of drive is I to S with a flip up towards the ceiling. If my patient had a cervical syndrome atlas, there would be no tender nodules, and I would simply set up for an atlas toggle.